Today we're talking about a pain reliever called Celecoxib. You might know it as Celebrex. It was designed to be this incredible, game-changing drug. But as we're about to see, this solution came with a pretty serious catch. Let's get into it. So, think about this for a second. What happens when you try to fix one thing, but you end up creating a whole new problem, maybe even a more dangerous one? Well, that's exactly the story we're diving into with Celecoxib.
All right, let's set the scene. For years, if you had pain or inflammation, you'd probably reach for what are called NSAIDs. Things like ibuprofen or naproxen. And they work great for the pain, no doubt. But they come with a really well-known and often nasty downside.
So, why do they tear up your stomach like that? Well, it's because these drugs aren't very picky. They're designed to block the enzyme that causes pain, but they also block another crucial enzyme that's just minding its business, protecting your stomach lining. It's basically a textbook case of collateral damage.
This stomach problem was a huge deal for a lot of people, so scientists started asking, hey, can we make a smarter drug, something that can hit the pain target without taking out the stomach's defenses? And the answer they came up with was a whole new class of drugs, with Celecoxib right at the front of the line. This is the absolute best way to think about it. Those traditional painkillers, they're like a carpet bomb. Yeah, they take out the enemy, your pain, but they also cause a ton of damage to the surrounding area, which is your stomach. Celecoxib, on the other hand, was engineered to be a smart bomb, a precision strike aimed only at the bad guy. So let's meet the good guy and the bad guy in this story. Okay, first we have the good guy enzyme. This is COX-1. Just think of it as the friendly housekeeper for your stomach. Its whole job is to keep that protective lining healthy and strong. This is the one you definitely do not want to block. And then we've got the bad guy. This is COX-2, the instigator. This enzyme only shows up when you have an injury. It gets switched on and starts pumping out the chemicals that scream pain and swelling to your brain. So you can see, this is the one we want to shut down. So the genius of Celecoxib was its precision. The whole mission was to block that pain-causing COX-2 while just leaving the protective COX-1 alone to do its job. And in theory, that's the perfect combo, right? You get all the pain relief with way less risk of tearing up your stomach.
Okay, so with this really clever design, where does a drug like Celecoxib actually fit in? Let's take a look at the real-world situations where doctors might prescribe it. You'll see it used for chronic, long-term conditions like osteoarthritis and rheumatoid arthritis. Situations where taking a traditional NSAID for months or years could cause major stomach problems. It's also used for short-term stuff, like pain after surgery or really bad menstrual pain. It's a pretty versatile drug, but this is where the story takes a very, very serious turn. And here it is, the other edge of that double-edged sword. Because even though Celecoxib was great for the stomach, a much darker, hidden complication started to surface. One so serious that it earned the FDA's most severe warning. It's called a black box warning. And let me tell you, when you see this on a prescription, it is serious business. It means there are major, sometimes life-threatening risks you need to know about. For Celecoxib, this warning points to two huge areas of concern. The first risk is all about your heart and blood vessels. It turns out Celecoxib can increase the risk of blood clots, which can lead to a heart attack or a stroke. The thinking is that by only blocking the COX-2 enzyme, it might accidentally throw off the body's natural chemical balance, kind of tipping the scales in favor of clotting. And this isn't some far-off risk. It can show up within the first few weeks of taking it. And now for the real twist. The second major risk is your stomach. I know, right? You're probably thinking, wait a minute, wasn't that the whole point of this drug? And you're right. But here's the thing. While the risk is lower than with old-school NSAIDs, it's not zero. Serious, even fatal stomach bleeding can still happen, and sometimes it happens with no warning signs at all. So because of these really serious risks, there are definitely some people who should just stay away from Celecoxib. That includes anyone who gets things like asthma or hives from aspirin or other NSAIDs. It's a no-go for women in their third trimester of pregnancy, and this one's important, anyone with a sulfa drug allergy because of the drug's chemical makeup. So, you see the dilemma here. We have a drug that could save your stomach, but might put your heart at risk. So how on earth do you decide if it's the right choice? Well, it all boils down to a very personal calculation of the risks and the benefits. This table really breaks it down nicely. Let's say you have a history of stomach ulcers, so your GI risk is high, but your heart is in great shape. For you, Celecoxib might be a much safer bet than ibuprofen. But now flip it.
If you already have heart disease, that increased cardiovascular risk from Celecoxib could be a deal breaker. It's a true balancing act, and it's different for every single person. And no matter who you are, there is one golden rule when it comes to minimizing these risks. It's something every doctor knows. You always use the lowest dose that actually works for the shortest amount of time possible. This is definitely not a drug you just take casually or for the long haul without a very good reason. Ultimately, the story of Celecoxib is just a fantastic reminder that there's really no such thing as a perfect drug. There are always trade-offs, and it shows why the single most important conversation you can have is the one with your doctor, where you lay out your entire health history and figure out what the risks and benefits look like for you. Because in the end, that's the only question that truly matters. Thanks for tuning in.